please introduce yourself and tell us a bit about your role within haematology?
My name is Professor Francis Preston. I was in my 5th year at university. I joined the army, and after my compulsory year, I went into the army for 5 years, of which the vast majority, of that time was in Germany. And I worked in a laboratory in Germany. I then applied for a job in Sheffield as a senior registrar in haematology, and then was promoted to consultant in Sheffield.
So who or what sparked your interest in haematology?
I think it started in the army, where I had a job both in the laboratories and clinical medicine, and I developed the interest there.
What do you consider to have been your greatest achievement from that initial appointment in Sheffield onwards? What was your greatest achievement within haematology, or what are you most proud of?
I think I'm most proud of being first named author in an important paper in the New England Journal of Medicine, together with colleagues in my own department. Yes, the paper was about prostacyclin production and prostacyclin, thromboxane, and the value of aspirin.
And so that's made a great impact around the world.
Yes, that's correct.
So you've been involved in many organisations within haematology, the British Society of Haematology, NEQAS, ISTH, but what do you consider your greatest achievement within your haematology career?
I was proud of being president of the British Society for Haematology. I was also president for hemostasis and thrombosis. I think they are my proudest achievements.
Very good. Which individuals do you think have made the greatest impact on haematology over the past 60 years?
In haematology, it was Professor David Weatherall. In the context of hemostasis and thrombosis, I think the most important person is Professor Frits Roosendaal from the Netherlands.
So as haematology has changed over the course of your career, what role do you think the British Society of Haematology has played in the development of haematology?
I don't think the British Society for Haematology has had any specific impact on the development of hemostasis and thrombosis. On the other hand, it has nurtured and supported people who are and were important in those areas.
You've explained that your main focus was hemostasis and thrombosis. What aspects of your career have given you the greatest satisfaction?
I think the development of anticoagulants, thrombolytic therapy. I was particularly involved in hepatitis C and HIV in patients with haemophilia.
Okay.
I think this probably was the most important aspect of the work I've been doing.
So what we often talk about in a conference, I went to EHAD most recently, and obviously with the novel agents for haemophilia, the gene transplants, the fact that in hemostasis and thrombosis things are changing at the moment, and obviously they've been changing for many years, but it seems like it's really ramping up just recently.
I think the area that had the greatest impact on me was haemophilia and AIDS, which is not strictly speaking hemostasis and thrombosis, but it was shocking, it was awful, it was tear-wrenching.
If you could give any advice to a brand new consultant in hemostasis and thrombosis, what would it be?
I think it would be no different from advice in respect of general haematology. That is, I think research is extremely important. Working with colleagues in the same area is also very important. I don't think one can give specific advice about specific areas of hemostasis and thrombosis. It's basically working together with people on projects and performing research in the area of hemostasis and thrombosis.
If we think about haematology as a whole, including the hemato-oncology areas, the general haematology,
Yes.
what do you think are the biggest challenges currently facing it as a whole?
I can tell you what the biggest challenge was, but not is.
Please do.
I think in the past 20 years, the biggest challenge for haematologists has been in the area of HIV.
We haven't mentioned yet your role within NEQAS and how very important and vital that is as part of laboratory medicine within hospitals. How did you get into that role within NEQAS? What was the career path to become more involved with laboratory medicine?
Initially, NEQAS in blood coagulation was run from the Royal Free Hospital in London. And I applied for the job, but stated that it had to come from Sheffield, not London, because it was quite apparent that throughout the world, some laboratories were obtaining extremely accurate results, whereas other laboratories were obtaining inaccurate results, inaccurate diagnostic results, and which had a great impact on patient diagnosis and treatment.
And that inspired you to become more involved with?
Yes. And dare I say it, our scheme was and is much better than the scheme in the United States.
You may say it. I also note that you were involved with the British Council in Brazil scheme. Do you want to tell me a bit more about that?
Yes, I was responsible with one or two others in establishing a hematology unit in Recife, Brazil. So we set it up, we established it, and it continues to be highly successful.
The divide between non-malignant and hemato-oncology practice is widening.
Yes.
From what I've observed over my training and potentially from what you've observed over your career, how do we attract people to choose non-malignant haematology?
I don't think this is very difficult. The disciplines are totally different, totally different, and there's a choice between one or the other. In many respects, they are not related. In some respects they are, but in many respects they are not. They're totally different disciplines.
But how do we attract people to choose non-malignant?
I don't think it's necessary to attract them. The disciplines themselves are attractive in themselves. I think UK NEQAS is extremely important. It identifies those laboratories that are obtaining poor results, which of course could influence the diagnosis and also treatment of hematological disorders. And the number of variables that are and can be responsible for false results have to be identified and have to be dealt with. The UK NEQAS organisation, although it's called UK, in fact covers quality control in very many countries throughout the world. We are able, therefore, to identify laboratories that are performing poorly, and in addition, UK NEQAS also offers support, and people will go over to other countries, to other departments in other countries, and give advice, technological technological advice about the methods that are used, and can offer advice about how to change the reagents, change the methods, and so on and so forth. So it has great importance throughout the entire world.
Your career has involved clinical and laboratory roles.
Yes.
Do you see that as being important for the haematologist of the future to have both aspects?
Absolutely vital. I understand that in many parts of the United States it's either laboratory or clinical, but I think the UK system, where the consultant has involvement in both issues, I think that is far, far superior.
You've retired from clinical practice, but are you still involved within haematology?
Oh, I'm retired from clinical practice, but I remain a co-director of UK NEQAS based in Sheffield.
Thank you so much for meeting me today. It's been a real pleasure.
It's been a pleasure for me as well. Thank you very much.